Hi everyone, this is Dr. Stefan. In this video I'd like to discuss about a question that I received on my channel, which is related to this Turbuhaler Symbicort inhaler. So basically, a lot of patients are wondering whether they've taken this medication correctly. Now, I've made a video on my channel about how to use Symbicort, so you can find it there, and I have a couple of frequently asked questions that I've answered to before. But this one I think is quite important, because many patients who are prescribed this type of inhaler, they don't really know whether they're taking it correctly or not. Now, one of the reasons for that is probably because the newer versions of the Symbicort Turbuhaler, the powder that's contained inside the inhaler itself, so the medication itself, doesn't really have a taste. That's apparently what's been reported by many patients. So in that situation, it's very difficult to say whether you've inhaled it or not. Now, one thing that I would point out is because it is a powder and you're trying to inhale it deep within the lungs to the small airways where it actually needs to act, the fact that you don't feel anything in your mouth or you don't taste a lot of powder there, it's probably a good thing. It may mean that you've actually inhaled it deep enough. Now, obviously, using the correct technique to inhale this will probably guarantee that you are taking it correctly. So if you have a good technique, if your doctor has told you that you are doing the right steps to inhale this medication, if you're taking it correctly, I think you are probably getting the right dose. And also, if your asthma, for example, if you're taking this for asthma, is well controlled on the medication, that's probably another indication that things are going well. Now, I'll just illustrate the technique once so that you know what I mean. And if you're probably doing more or less the same thing, I think you're probably all right, even if you don't really taste the medication on your tongue, let's say. Now, it's important to note that this is a dry powder inhaler. So that means that there's a small amount of powder that you're inhaling with every administration of this medication. So usually you take the top out, and the way you arm this device is usually to twist one way and then back. So usually I twist it like this and then I twist it back, and you've heard a click. That means that it's armed. Now, in order to mobilize the powder from inside the device, I need to be able to generate enough flow to get it moving. So that means that you really need to be quite forceful when you breathe in. You can't just do something like, it can't be like that. That won't generate enough force to pull the powder from inside the device. So what you need to do is really to empty your lungs of air first, and then with empty lungs, you put your mouth on this little mouthpiece and you breathe in forcefully and deeply, hold your breath for about 10 seconds or as much as you can, comfortably, and then slowly release. And that's really the whole technique. There's nothing more than that. So I'll just demonstrate that to see that it's not really complicated. So let me do it now. I'll breathe out and then inhale forcefully. And slowly release. So that was basically it. That was the whole technique. So I didn't feel anything really in my mouth. I don't feel the powder. Now, this is a demonstrator device, but it does contain a little bit of lactose inside. So I should have felt something, but I didn't. But probably because the technique was more or less correct. So if you're doing more or less the same, I think you're all right. So don't worry too much about it. If you have any issues, do talk to your doctor all the time. Don't take advice only from the internet, from me or from forums, from other comments. Go to your doctor, to your healthcare professional, visit them regularly, and I'm sure you'll be fine. So that's the only way to have a good outcome in healthcare, to visit your own health professional as often as you can, as often as you need. So thank you very much for watching. Hope this was helpful, and I'll see you in future videos. All the best.